Greetings to all, and thank you for tuning in to our monthly Katz Conversation, a series where we get intimate with all of our Katz Institute for Women's Health experts. I'm Sharon Zarabi Fern, and I have the privilege and honor to speak with Dr. Christine Molmenti, a cancer epidemiologist with many accolades as part of Northwell. Dr. Molmenti, thank you so much for being here with us.
Thank you, Sharon. It's great to see you. Thank you for inviting me.
No, we're happy to have you. And you seem to be embedded in so many departments within Northwell, the Katz Institute for Women's Health, the Cancer Institute, Feinstein Research, and Zucker School of Medicine. Can you share what inspired you to focus your career on women's health?
Yes, that is a great question. And it's one that has evolved over the years. From a very, very early age, I became interested in disease prevention and public health and medicine. And that really spans both men and women of all ages across the life course. But it really started to formulate into women's health when I was in my fellowship at Columbia University. I was doing an NCI fellowship in cancer epidemiology. And I was part of a couple different women's studies. One is a national study called the Sister Study, where we are looking at family history of breast cancer and complementary and alternative medicine use. And I was also part of another large multi-center study called it's a SWOG multi-center trial looking at weight loss in women who were colorectal and breast cancer survivors. So I had my initial formal academic entree into women's health in 2013. And it wasn't until I came to Northwell and became a faculty member in 2016 and then applied for my first CATS grant in 2020. And I had been focused on colorectal cancer prevention for about 23 years. And I finally said, how can we apply this to women? And when I looked at the data, it was striking that colorectal cancer, especially in young women, was the second leading cause of cancer death, which is not known and does not get the spotlight.
Wow, no, thank you for sharing that with us because I think when we think of colorectal cancer, so many people think, oh, it triggers, women, men more than it does women. And it sounds like you've been doing this for so long. You seem to actually be a pioneer in women's research because women have been understudied for so long. So thank you. Thank you for all your contributions.
I just have a big opportunity. And it's something that, like I said, hasn't been in the spotlight. It's affecting a lot of women nationally and globally. And there's very low awareness, just like you said. And there's data to show that some women think this is a male disease. And it affects every single woman in the United States today, and something that we all need to be part of. And that's why I'm so happy that I have all these different departments and institutes that I can be part of to bring groups together, to advance the research, to increase the awareness. And that's really what I'm focused on currently.
Oh, well, we thank you for all of that. And I mean, just considering everything that you just shared with us, what has been the most rewarding part of your career and your life?
That is a big question.
It's loaded.
I would say that there have been many time points along my career journey that have been very rewarding. And I just think one of the common themes for me has been the mentorship and the mentors that I've had the opportunity to work with over the last several decades. I feel like I've had a really unique opportunity to learn from the best in the field, and that has been absolutely, pivotal and very rewarding. But also having the opportunity to work with my colleagues and collaborators, and just the opportunity to help people. And everyone who's in healthcare always says, I want to help people. But when you can really put that in action and you speak to someone and they take a step that may prevent disease or improve their health, that is extremely, sorry, rewarding.
Your fellow dietitian, which I think you did not mention. And I've heard you speak. You are pivotal in our Go Blue campaigns with the Katz Institute for Women's Health. I know we have a lot of webinars of you speaking to bring awareness to colorectal cancer and women. And I'm just wondering, just with all of this going on and so much of what you speak about in cancer prevention with lifestyle and nutrition. How do you manage to take care of your health? You're a busy mom, you're a doctor, a researcher. Where do you find the time and how do you just juggle it all?
Well, I will say 80% of the time it's a struggle, and sometimes work-life balance is non-existent. And I think anyone who's a mother knows that some days you just survive. But then there's some days where you actually feel like I got this, and you can have a good meal. You can exercise, whatever that is that you may like to do. For me, the most important thing is diet. I think that that has a tremendous impact. We all know the gut-brain connection on your mood, on your ability to cope with life. In addition to, and what you put in your body truly, impacts your way of thinking, your ability to think. Also coupled with that is exercise. And for me, even from a very, very young age, whenever I had a big exam, whenever I had a very stressful event, I would walk and I would carry my books and read while I walked because it just creates, of course, the endorphins and an elevated sense of sort of, it gives you just more, I guess, energy
Yeah,
and empowerment to get it done. And when you have so much going on, you need to have that very strong mind and very strong body. And without those two things, it's very hard to be successful and be productive.
yeah.
And I'm not saying this is all the time, but if you can do that the majority of the time, it makes life a little bit easier to get through.
So then how do you manage? Because I hear you and you're preaching to the choir. I'm so much into wellness. How do you manage to find the time to do that exercise? I mean, I'm sure you've heard patients say, well, I just don't have the time. I'm taking care of the kids. I'm going to work. I'm the caretaker of my parents, my aging, parents. So how do you like, is 15 minutes enough? Do we need to be in the gym for an hour?
Well, this is so interesting because I spent a lot of time studying sedentary behavior, and it's the prolonged sitting that sitting is the new smoking is one of the taglines. But prolonged sitting is probably one of the most deleterious things for your health. So if you are a busy mom, I mean, there's days I have no time to do a formal exercise. And if you can just stand instead of sit, if you can take a call standing, if you can just move around, even if you wouldn't check the box on a questionnaire that says you're an exerciser, the busy mom may be more healthy than the young man that rides his bike to work, says he exercises 30 minutes a day, but he sits for 9 hours.
Hmm,
So I think for women, for the general public, when it comes to being healthy and not having the time, it's micro interventions. It's finding little tiny things throughout the day, a stretch here, a stretch there, breaking up long periods of sitting as best as you can could really be very impactful on your health.
I love that. Micro interventions. All right, that's a key takeaway.
Going to, you don't have to go to the yoga class. Some people who are working all day, the last thing they have time to do at the end of the day is a yoga class when they have to get home. And so that's why it's incorporating little things throughout the day that can add up to be very valuable for your health.
I love that. If there's any nugget of knowledge someone takes away from this, it's going to be that micro intervention. Um, and here we are talking so much about like medicine and research and lifestyle. What would you what would you like to do, or where would you see yourself if you weren't a physician?
Well, I mean, that's a great question because I always thought from a very early age, and I started volunteering at the hospital at 13. My lifelong goal was to be an MD, but where it turned out to be for me is that I became a doctorate and really a physician of public health and a doctor of public health, which is broader than the one-on-one consultation with the patient. Although, as a dietitian, I did do that many times and I've had hundreds of consultations. But when I'm talking about public health and designing interventions for the public and helping large groups of people through education, through research, it really has a very impactful effect. And if I wasn't doing that, I would probably be doing something related, which would be something creative, probably related to entrepreneurship, um, providing ways that people can access healthier foods, like have a food company. I think that would be my ultimate dream, is to have a company that would make foods that are accessible, convenient, but not full of all the ultra processing that we know is so harmful.
Right, right. And now with the new food guide pyramid, and we're trying to get rid of processed ingredients.
Yes.
This was great. I mean, I could speak to you for hours, but we are getting to the end of our segment. So we're going to end on a fun note. It's going to be a little more light with just a quick fire round of questions. I just want you to tell me the first thing that comes to mind. No overthinking. All right.
Okay.
All right. So what's the one skill you wish you had?
Um, well, I do play the piano, but I'd like to play it better.
Okay, some music. What's the one thing you can't start your day without?
Green tea.
Okay. Oh, that got me to my next question, coffee or tea?
Right?
Is it green tea over coffee?
Absolutely. I'm not a coffee drinker, but I do have it every once in a while.
Yeah. Um, are you a texter or a caller?
Well, I'm forced into text, but I feel like there's miscommunication with text. So I would prefer to call, but it's just too inefficient.
Okay.
I think dictation is one of the liabilities, voice dictation, because it always makes
Yeah,
mistakes.
you always got to read a proofread before you press send. I've made that mistake too many times. Window or aisle seat?
Window.
Okay, yeah. And are you spontaneous or would you consider yourself more of a planner?
Well, a little bit of both, but
Okay.
my gut says spontaneous, but I do like to plan. I do like to know what's coming.
Yeah, I feel like most women do.
Not always possible.
There's lots of schedules that we need to manage. So,
Yeah.
well, this was really fun. I thank you so much, Dr. Molmenti, for sharing your experience, your knowledge, your past of how you got to where you are. And we look forward to seeing more of you for our Go Blue campaign.
Thank you. Thank you so much for your time. I appreciate it. Thanks for the interview.
And thank you all for tuning in. See you next time.